Hi, this material is to complement the notes part of the study guide with regard to hyperparathyroidism. I'm using this presentation primarily to highlight the bone effects that one sees with primary hyperparathyroidism. So please refer to the notes for other details about the parathyroid gland and hyperparathyroidism. And we will revisit this in another course later on when we talk about some of the endocrine organs. So we'll circle back on this. So don't be concerned if you don't feel like you're learning everything there is to know about the parathyroid gland, which itself is a riveting topic. The bone abnormalities that we see in primary hyperparathyroidism are osteoporosis, brown tumor, and a condition called osteitis fibrosa cystica. Say that 3 times fast. So the good news is that osteoporosis, as it relates to primary hyperparathyroidism, is the same pathology as what we already talked about in the other presentation that covered osteoporosis. So there's nothing really new to learn about that. We do see generalized osteoporosis in primary hyperparathyroidism, but it is most severe in the phalangeal bones, vertebrae, and the proximal femur. So some slightly different sites than we see with osteoporosis, but you can't really use that in terms of distinguishing. Just like in osteoporosis, we see increased osteoclast activity. It's most prominent at the cortical bone, so the subperiosteal and endosteal surfaces, but the medullary bone is also involved. So again, just to underscore, there's nothing different. It's the same osteoporosis, same pathology. It's just associated now with primary hyperparathyroidism. A more specific bone finding that we can see, however, is called dissecting osteitis. This is an unfortunate name because it's not truly dissecting and it's not inflammatory, so it's not really an osteitis. And when we see our osteoclasts that appear to be tunneling into and dissecting along the central length of trabeculae, dividing it so that it has the appearance of railroad tracks, while the marrow spaces around the affected surfaces are replaced by fibrovascular tissue. So that's a mouthful. Let's look at a picture. So this is a low magnification view showing features of dissecting osteitis. And so here we have the length of a trabecula going this direction as well as one going this direction. And you can see that the bone shows these abnormal areas kind of within the trabeculae themselves. And we'll see on the next slide at a higher magnification, but this gives the impression, as indicated by the blue arrows, that there is this fibrous stroma. It's hard to see the osteoclasts at this power, but it looks like they're dissecting into the bone trabeculae. And at higher magnification, we can appreciate really what's going on here. The marrow space is replaced by this fibrous tissue. That's all this spindly cell stuff with collagen. And then the circles show multiple osteoclasts, which appear to be tunneling into along the longitudinal length of the trabeculae, creating the appearance of railroad tracks. Woo-woo! Another form of bone involvement with primary hyperparathyroidism is the formation of so-called brown tumors. They're given the name brown because they are very vascular and thus have a rusty brown, reddish brown type appearance. These are an expansive brown tumor. These are not neoplasms. They're called tumors because it's a nonspecific term meaning swelling or growth. This is a cross-section of rib, so that's the costal cartilage on the surface here and along the edge. These brown tumors are generally appreciated by imaging and not treated with surgery. If the patient does go to surgery, you usually don't get a resected fragment of bone. The surgeons generally core these areas out And so we get in pathology a bunch of fragments like this, and then it's replaced or packed with normal bone from some other location. Microscopically with brown tumors, what we see are the proliferation of osteoclast-like giant cells. So these aren't truly osteoclasts, but they resemble osteoclasts in that they're multinucleated, they're large cells. They generally occur in clusters. Here's another cluster of these giant cells here. Oops, I guess I should highlight the pin. Right here. These are more modified macrophages, but they appear to be like osteoclast-like. And so the tumors are composed of these spindle cells with these clusters of osteoclast-like giant cells in the background. Osteitis fibrosa cystica is the combination of increased bone cell activity, peritrabecular fibrosis, but most importantly is the occurrence of multiple small cystic brown tumors. So if you looked at each one of these lesions that are highlighted by the arrows, or here's a cluster of them in circles, you can see them if you look at each of these vertebral bones, a bunch of these clear spaces. These are all small brown tumors because they're radiolucent. They have a cystic component, and osteitis fibrosa cystica just means that there's multiple of these, usually involving multiple bones. So that's it really for the bone effects seen with primary hyperparathyroidism. I just wanted to show you some images to, again, complement the reading. Thanks.